Kani kadiga Batisi TV, mat pidang pek yaki kubor baman kasni, belawan rasha pida ka Orange Nissan Loom Sopo near Fire Brigade Shong, ringkat bat ka eco-friendly enterprise, ki plakot nagamenta ki jingdon kam hakasong, bat kara karong.
Palat arbanai menta baki nong tray hakatnat ka kot kakya kamtam kitu ki batray haki hospital, ki layat nanti banyakon yakatma jong kunyang jingpang COVID-19, hakaleng kari India, handai ke basngo lingo banyak ngopan. Baha kawai ni ki jaka Sumar ka badairu jong ka sarkar pedeng. Kinong tray hakani ka hospital kamtam kitu Kiba dan haki jaka basumar ki bapang COVID-19 kilamat jing Hadu balapoi upot bakin pelong sundan da kejing ki dakalanti ka bajai-jai. Haka kan rew trek mata bna jeliu arajar arpo. Ki nurse jong ka Neigrihms hospital mau deng kila pelong da kejing ki da ka badeng ribon yong. Ban penpau ki kejing persya ki bor penya jong ka ni ka hospital. Halor ki babon ki jing duna bat kawai kamat ka bakam kongsan bakila yang persya. Kalong halor ka jing bamsya ya ki to kinong tray ki bala sumari ki breu ki bayo yok nyang jing pang COVID-19. Ban Shong quarantine kat saus ngi. Kat kum ka jing tha jong katnat ka koi ka khya. Handai la phali phai be ya ki sheyeng ka balong pat ka jing ma ya ki bahieng basam jong ki.
Our strike or protest today starts with our wearing black badge. We the Neigrihms nurses, we feel that nurses in all over India has been discriminated. Though we are forced to work, we have not been given proper PPE from the beginning of this pandemic. After that, the quarantine has been cancelled in the center. And in support to the center, we are standing here in support to our nursing profession too. Because we worked with the COVID patient who are positive, and we are being sent home where we have our family. Some of us has minor children, all age mothers, parents, mother-in-laws. So we have been exposing them, and we are actually the carrier of virus. So we have put our demands. It is from the month of March that we have been approaching the authority. Before the COVID in Neigrihms, we have written many letters demanding that proper PPE should be there. There should be a quarantine facilities, and the nurses should be provided with accommodation and food during their duty hours. So all these demands, they have been assuring us verbally, but when the really positive comes, one case only has come with a pregnant lady. Only with this one positive woman, we have come to realize that they have given us a false assurance that Neigrihms is ready. We are also saddened that in the media it was revealed Neigrihms is all ready to face COVID pandemic. But it was a false assurance given to us nurses, and we feel we have been neglected. We fought for accommodation, we fought for food, now for quarantine place. So we have also written a letter even to the state and to the health minister. We have not received any written circular or written support. So it has forced us to stand together as nurses, because we are being circulated in COVID area. 1 week we do duty, and we were supposed to be quarantined for 14 days. There is nothing written assurance that we will be quarantined. And very sadly, we have to reveal that we are doing duty from home. We come from home to do duty with the COVID patient. The mother who has given birth has to be attended by the nurses. They come from home. After their duty hours, they went back home. How safe are the nurses? How long can we work? That is our first demand. Second, along with the nursing profession, we would like to demand to the state, to the government of India also, to provide us with proper PPE and quarantine the nurses in a proper way. The government needs to look into this matter. The standard of operation procedure should be reviewed and it should be revised. Nurses all over India have suffered. There are many cases who have been positive. Nurses in AIMS, 400 plus, they have been positive. they provide the PPE, and that seems that they spread the assurance that by providing PPE, nurses are safe to work. PPE doesn't protect us from the virus. Our next step is that as we have started and nurses are united against this non-quarantine, we have taken the first step of wearing this black badge, that we are supporting our friends who are posted in COVID area, that they should be quarantined immediately after their posting is over. And the next batch that will be going to the COVID area should also has the similar facilities. And the contract staff should also get the same benefits as the permanent staff. They should also be quarantined. Here we speak about the health workers in Neigrihms. Not only the nurses, but the doctors also should be quarantined. Health workers like the cleaner, those are ward attendants who are being exposed to, they should be quarantined. Director, we have not met. The first thing is we are very saddened by the director words. The last director who has left Neigrihms, he has given a false, very wrong information to media that Neigrihms is very much ready to face this pandemic. Then we have only an acting director. As of now, we don't have a director. Acting director is responsible to look into this matter. We have written a letter which has not been responded. On the 12th of June, we have written our demand, everything we have given in written. When they have not answered us in circular or in written information, they have given in media that Neigrihms staffs has got thousands to quarantine. They cannot quarantine and they don't have fund. All these things are not given to us in circular or in the form of written. Nurses are not being informed that Neigrihms is too poor to handle the nurses. Where we can handle the COVID, why not take another steps to care for the nurses who will be taking care of these COVID patients?
Kan ni bang ya penlong event strike minta kasi ke long ba nomor ba nadu bana March nadu pasrang kan ni ka COVID area ni ka COVID pandemic ni ladep ong ladep ya one chapo director ni ladep thok thi cho deputy director ni la ong ba ban penbiang ya kini ki jakasa ja phang kini ki ya ki staff ki bala bu ha kini COVID area ni dan ki jong ki area ki dan ki non COVID area ni claim ong hero ban pha cha quarantine la ni ki jakasa hadin bala ladep duty ya ki tu ki ba don ha ki non COVID ni ong dang itu ki batrai bat kini ki COVID patient bat ni ki COVID area dia jing ha ngila thok stiro bat ngila yo ru ka reply ka ong ba ngin kia ka quarantine facilities will be managed, will be given, arrangement will be given. Te haduk mentaro ki klempat ai kata ki thok tang kata ka response ka we ka kata ka response ka de hau arfu tarik jong pada April kata ke bangila tho tingila up dia kata ti hadin nang ta pada ngila le ya kren biang ya kata ngila le sibun bah ningkong ngila hadin ta kila ay ka jakasa yakin ki badan duty haduk mentar ngilang don ka jakasa ki badan duty tang ki badan duty hadin badap duty ki haban le no sayeng ti tang ba phila yu ka ma fitep mentang yem tep bah jinglong jong ni virus kalong gumno but ki kan pak quarantine pat ki su ai tang ka jakasa during duty hours ti kata ru kalang kala manwara ka jingma ya ki yeng ke sem nemar bon ngi mde tang kin nurses baru ki support staff ru ki sa ki yeng ki barin ti da ki le chayeng ki ong home isolation kanu ngin la home isolation te kalong ka jingma mde tang yengi ndre ka jingma ru ya ka jakasa ya ka society ya ka community ka locality ka bangingi sa kumtana ta ka daw ngi yang hang ne ban ya strain bar haduk mentang yem yo ha kani ka arterik ngidang ai biang gawe ka city show director bar uklam ni jubab ya kata ka city sangi na kata ka daw bar hak tu ka city ngladap ongro ba ladang yem yo ya ka jubab ngin haban chim ya ka ngile da ka drastic action ani ngile action ngin chim na da ki action bar namta na ta ka daw ngila straight no bar hatu ka city ngila tho ban don quarantine di quarantine facility ya kini ki COVID staff ni kham hero barkatu ka baru director jongi habu thok sa ka media uang ba daki hajar tingi klem ong ye ki hajar ngi ong tang ye gitu ki badon hapo COVID henry ya mentam 4 don hero 4 don kata ka quarantine ti menta kini ki badan duty hang tu ki ong ngim nut chu ban le cheyeng bat menta ka si ki balakut ki nom nut chu ban le cheyeng tang ha ban ye yang lang bat ki tang ibu ni black batch ha ka jo ka por ngila ong ye ki ba ban le no mandatory testing ya kini ki badan COVID duty ban le test ya kan ka COVID yo bakidan kataru ki ong bam long syo ban le na makat kum kata ka guideline ka bajong ka ICMR ti ki obang ginom le syo kat bam padan kepadan dak kisin sabar hendai ka bayu i mentah barok koi ke perthai ka bayu i mentah tang India ro kiba bon kinongkit kimdei kibadan kidak kisin sabar kiba bon kinongkit kidei kibom pang badna kata kadang ngitiang ya kata ro banra sayeng barlada sumut dun mentah ngin let sayeng kan long kan explode kumba explode chakiwei pat kiri lani kan kibabon hakin ya ka bit ujing pang balada bit iwei sa iwei kan long ka jing bit ka pateng kadang ngim kwa ya kata pat ngilai iru bakal long ka discrimination kin yang yakin ki support staff haduk menta bat kat kum kila dang ngilet ya kren ki ong ba kata ka guideline ka bakum ta hendai ha ka state kidang ong ban hable ha ka state menta ka ka state ka le ya ki badan hapa covid area kumut ki aya kata ka 14 days quarantine hendai balai mengipat ngimla men ki ong bangin ka change ka protocol kan change la dan covid patient iwan tang iwei khlem ka wei ka hospital iwan tang iwei ngi pen poi saki santali ki department ngi khlem la ban contain tang haka covid area department tang iwei nang kata ka daru ngi condemn hiu dondal officer tang iwei case ka ka bajang ni ka pau bangim pat pen kre tang ka wei ka case ngimla ban te lakam ngimla ban bu lara de pakadon betang hapo covid area ngin pat poi haduk kat ni hendrai menta ka poi pel keleng kan ni ka ja kapen ibang ngim nadu condemn hero ya kan ku noda officer kapen pau bang klem kain kor ya ka jing em jang ki wei pat balalat ya la jong ra long kum ta ho ning kong ting ngi ru khin ben hin amar bale hapo ki hapo ha baning kong ki patre klem PPE ki om lai le phong tang tu la biang dalai yo PPE ki ong dan kam quarantine chu la phong PPE phim bit chu chano haba dalam kumta Malaysia Ïakhih ki babon ki nong tre ki kabakentup ikini ki nadu ki ward attendant nadu ki nurse nadu ki doktor balai ki babon ki yo pang ngim kwa ban kan long kum ka wei pat ka Ïakhih ngim kwa ba ka kari ka jongi nani kari Meghalaya jongi kan kelalong kum ka Delhi kababon hakikis dan nata kadang ngi sapersha am namar bangi kwa tangel dedi ringi perkhat ya ka kwat ka khia jong ka rihi parok ka wei ada mentangi ra mangi kinong tre ki batre kini ka hani ka khani ki ki babon ki bawan ki kendu engi kinong pang na kinong pang kiwan kinong am te hang ta nanong ap kila le chayeng hayeng hasem ti kanwan ka jing sapret kin jong kan ni ka jing pang ta kadang ngi sayeng ban persha ya kani am dalawai du tingi la le chayeng dan nalor kata ngi don ki bus toh bon na ki staff ki don handa ki ba ki kong ki wan na ko juk ka bus kitu ki badan duty apa quarantine ro apa covid ro ki let ka juk ka bus te habakum ta hang kata ka isolation kam dan procedure dan protocol la kapau bom dan protocol la da de ba ki la sim khia ya ka ba ka bangila tho bangin le kum ta nginum poi sadu new port handa kan ka department la ni ka Neigrihms ka administration kam sim la sim khia takadang ni sapoi hakani ka por bangin hapan sim na kini jingya khi ni jingya le persha ka barai ka bang ni kwa menta ka long ba kinang bon hi jing ki ban ngin persha ande ka bang ni kwa ba ka administration kan le ka long ba kan sim yang jingket khli ka bang ni kwa menta ka long ba u director un tho la ni un aida ka press release ka ba ong balada don ki ba pang ba sitam ha yeng ha sem jongi kenthop ya ka community ka bangisa ka hospital kan sim ya ka responsibility khnang banginom sha discriminate shaki locality ka bangi ngisa khnang banginam dan gono ka jingja ngihap an protect em mangi la jong ro khnang ba kanum dan gono ka jingja ha kilo locality ka bangi ngisa undang ikwa hi ba ka administration kan chim ya kan ni ban ai da ka press release ban ong ba kan chim ya ka jingget khli
ये हम लोग का जो है क्वारंटाइन जो होता है ड्यूटी के बाद में जो कोविड एरिया में काम करते हैं नर्सेस हेल्थ वर्कर जो भी है उनके लिए क्वारंटाइन के लिए हम लोग ये प्रोटेस्ट कर रहा है इसमें हम लोगों को मतलब क्वारंटाइन नहीं दिया जा रहा है जो कोविड एरिया में ऑलरेडी ड्यूटी में है या वो ड्यूटी कर रहे हैं उनके लिए कोई प्रावधान नहीं है यहाँ पे और बोलते हैं कि क्वारंटाइन नहीं आप घर जा सकते हैं आप सोचो एक कोविड एरिया में अगर पेशेंट आया है या नहीं आया है उसका सैंपल लिया जाता है उसका रिपोर्ट भी नहीं आता है तो स्टाफ कैसे घर जाएगा कैसे सोसाइटी में जाएगा कम्युनिटी में तो ये खुद चाहते हैं कि कम्युनिटी में स्प्रेड करो डिजीज़ हम बोल रहे हैं कि हम लोग को क्वारंटाइन प्लेस आप लोग दे दो और ये बात अभी का नहीं हम लोग 23 मार्च से ऑलरेडी लेटर दे चुके हैं डायरेक्टर को भी और हेल्थ मिनिस्टर को भी और बाकी जितने भी यहाँ पे जो NSA है उन लोगों को भी हम लोग दे चुके हैं लेकिन इसका कोई भी सॉल्यूशन अभी तक नहीं निकला है तो ये जो डिजीज़ कंडीशन है इसको रोकने के लिए हम लोग प्रयास कर रहे हैं, ये ज़्यादा ना फैले, लेकिन एडमिनिस्ट्रेशन इसके लिए हम लोग को कोई प्रावधान नहीं दे रहा है। और दूसरा डिमांड है कि हम लोग का जो भी आउटसोर्सिंग है, आउटसोर्सिंग स्टाफ है और जो भी 4th ग्रेड स्टाफ है, उनको भी जैसे दूसरे हेल्थ वर्कर को मिलता है सुविधा, उसी तरह मिलना चाहिए उनको भी। हम लोग का बस यही डिमांड है, बाकी कुछ एक्स्ट्रा डिमांड नहीं है। और हम लोग का यही है कि हम लोग को दुख है कि हम लोग का डिमांड जो है सुना नहीं गया है। हम लोग कोई एक्स्ट्रा नहीं ढूंढ रहे हैं, हम लोग अभी ब्लैक बेस प्रोटेस्ट कर रहे हैं और इसके बाद अगर नहीं सुनेंगे तो हम लोग मजबूरन हम लोग के नर्सिंग प्रोफेशनल के लिए हम लोग मास सीएल लेना पड़ेगा।